coming to the second video in developmental disturbance of tongue. So in this video we will be seeing about Ankyloglossia and Cleft tongue. First coming to Ankyloglossia, as usual we will try to separate the name to understand what this is. So separating Ankyloglossia into Ankylo and Glossia. So Ankylo means something which is stiff or which is rigid or immobile. Glossia means tongue. So the name shows that here the tongue is very rigid or very stiff or immobile. It is also called as tongue tie. Now we will see what it is. Okay. So Ankyloglossia is when your inferior frenum, the inferior frenum is completely attached to the bottom of the tongue. So this is the frenum between the floor of the mouth and the tongue. So when it is completely attached to your tongue, there will be no movement of the tongue. It will be completely restricting your movement. That is called as Ankyloglossia. So here you can see the lingual frenum will be short and thick. Now we have two types of Ankyloglossia. One is total or also called as complete. The other one is partial. So what is total is when your ventral surface of the tongue, that is the upper surface we call it as dorsal surface and the bottom surface of the tongue we say it as ventral surface. So when your ventral surface of the tongue is completely fused to the floor of the mouth. So imagine this is your tongue, the dorsal surface, the ventral surface. This is the floor of the mouth. So when the ventral surface of the tongue is completely fused to the floor of the mouth, then we call it as complete Ankyloglossia. So here there will be no movement at all. It will be a very restricted movement you can see in total Ankyloglossia. Whereas partial, there will be some limited movements. In this case, mostly it is like a very short liquid frenum can be there. There will be no complete attachment to the floor of the mouth. Now what is the clinical features you see is, in almost 1.7% of all the neonates you can see Ankyloglossia. When coming to the gender, it is affecting males more than female. It is almost like 4:1, male to female proportion. Mainly, the difficulty faced by infants are feeding difficulty because they cannot move their tongue. So, in such cases, when the neonates are having a severe feeding difficulty, an immediate surgery could be required to correct it and provide a normal feeding. Then coming to the speech defects. Here, patients will not be able to pronounce certain letters like Z, ish, it, n, t, r, etc. And the patients of Ankyloglossia will have a consistent spacing in the lower anteriors, and also open bite in anteriors can also be seen in cases. Now how do you check the tongue mobility is, when you ask the patient to move the tongue, it is said that some scholars have suggested that if the tongue is touching the tip of the lower incisors or beyond the lower incisors, then it is not gonna cause a severe issue. So you have to check for the tongue mobility in the patients. Now coming to the treatment, of course you have to relieve the frenum. You have to cut the frenum and relieve the frenum to provide a proper tongue movement. So you have to carry on with frenulectomy. So that's all about Ankyloglossia. Next coming to cleft tongue, also called as bifid tongue. Cleft tongue is actually of two types, same as Ankyloglossia, complete and partial. The complete cleft tongue is very rare, and why is it happening is when the lateral swellings, when the two lateral lingual swellings do not merge each other, when we can see complete cleft tongue. Whereas partial cleft is more common than complete cleft, and it is when there is incomplete merging of the grooves, incomplete merging and failure of the groove obliteration. And also when the mesenchymal cells do not proliferate properly, we can see incomplete or partial cleft. And this is more common in oral facial digital syndrome. Now when you see the clinical importance of this, it has no much clinical importance. Whereas, see for example, partial cleft, you can just see a deep groove near the midline of the tongue, and this can collect more debris, food debris, and we can see there will be many microorganisms growing on this. So it can be a sign of poor oral hygiene. So there is no other clinical significance. So that's all about Ankyloglossia and Cleft. See you again in another video with another topic. Thank you.